During cardiopulmonary bypass, CPB, which of the following is a primary concern related to metabolic management? A. Hyperglycemia. B. Hypokalemia. C. Hypoxia. D. Hypercapnia. Answer: A. Hyperglycemia. Explanation: during CPB, hyperglycemia is a common concern due to stress response, insulin resistance, and alterations in glucose metabolism. Stress-induced hormonal changes lead to increased glucose production and decreased utilization. Hyperglycemia during CPB can worsen postoperative outcomes, so glucose levels are carefully monitored and managed during surgery. What is the recommended blood glucose target during cardiopulmonary bypass? A. 70 to 100 mg/dl. B. 100 to 150 mg/dl. C. 150 to 200 mg/dl. D. 200 to 250 mg/dl. Answer: A. 70 to 100 mg/dl. Explanation: maintaining blood glucose within the range of 70 to 100 mg/dl is generally recommended during CPB. Hyperglycemia can increase the risk of infection and poor wound healing, while hypoglycemia can lead to adverse neurological outcomes. Tight glucose control is essential to improve postoperative recovery. Which electrolyte imbalance is most commonly associated with prolonged cardiopulmonary bypass? A. Hypercalcemia. B. Hypokalemia. C. Hypernatremia. D. Hypomagnesemia. Answer: D. Hypomagnesemia. Explanation: prolonged CPB can lead to the depletion of magnesium due to dilution and altered renal function. Magnesium is essential for proper cardiac and neuromuscular function. Hypomagnesemia during CPB can result in arrhythmias and other complications, so magnesium levels are closely monitored and corrected if necessary. Which of the following is used to reduce metabolic demand during cardiopulmonary bypass? A. Increased body temperature. B. Mild hypothermia. C. Hypercapnia. D. Increased oxygen delivery. Answer: B. Mild hypothermia. Explanation: mild hypothermia is commonly employed during CPB to reduce the metabolic demands of tissues, especially the brain and heart. By lowering the body temperature, oxygen consumption is decreased, which helps to protect vital organs during the procedure and reduces the risk of ischemic injury. Which metabolic process is altered due to the use of cardiopulmonary bypass, leading to an increased risk of acidosis? A. Glycolysis. B. Citric acid cycle. C. Oxidative phosphorylation. D. Fatty acid oxidation. Answer: A. Glycolysis. Explanation: during CPB, the body shifts its metabolism toward anaerobic glycolysis due to reduced oxygen delivery to tissues. This results in the production of lactate, leading to metabolic acidosis. Managing oxygen delivery and ensuring adequate perfusion can help minimize this metabolic disturbance. What is the primary purpose of adding bicarbonate to the CPB circuit during metabolic management? A. To treat metabolic acidosis. B. To increase blood pH. C. To enhance oxygen delivery. D. To decrease potassium levels. Answer: A. To treat metabolic acidosis. Explanation: bicarbonate is often added to the CPB circuit to correct metabolic acidosis, which can occur due to the accumulation of lactate from anaerobic metabolism during bypass. The goal is to normalize the pH and prevent complications such as arrhythmias and poor organ function. In patients undergoing CPB, the use of insulin is commonly indicated for the management of which condition? A. Hypoglycemia. B. Hyperkalemia. C. Hyperglycemia. D. Hypoxemia. Answer: C. Hyperglycemia. Explanation: insulin is commonly administered during CPB to manage hyperglycemia, which is a frequent occurrence due to the stress response, insulin resistance, and metabolic alterations during bypass. Insulin helps to keep blood glucose levels within a target range and reduces the risk of postoperative complications. What is a common effect of cardiopulmonary bypass on blood pH? A. Alkalosis. B. Acidosis. C. No change. D. Metabolic alkalosis. Answer, B. Acidosis. Explanation: CPB often causes metabolic acidosis due to tissue hypoxia, increased lactate production, and the use of hemodilution. This acidosis can be corrected by using bicarbonate and optimizing oxygen delivery during the procedure. What is the most effective strategy for managing blood gases during cardiopulmonary bypass? A. Use of hyperventilation. B. Maintenance of normocapnia. C. Use of hypoventilation. D. Hyperoxygenation. Answer, B. Maintenance of normocapnia. Explanation: maintaining normocapnia, normal carbon dioxide levels, during CPB is crucial for preventing respiratory acidosis or alkalosis, both of which can cause adverse effects on circulation and organ function. Normocapnia ensures that pH levels are kept stable and that oxygen delivery to tissues is adequate. Which of the following best describes the role of erythrocyte function during cardiopulmonary bypass? A. To improve oxygen delivery to tissues. B. To regulate blood pH. C. To store glucose for energy use. D. To enhance carbon dioxide removal. Answer, A. To improve oxygen delivery to tissues. Explanation: during CPB, erythrocytes, red blood cells, are crucial for oxygen transport. However, the bypass machine's oxygenator may not always fully mimic the normal oxygen-carrying function of erythrocytes, and blood transfusions may be required to maintain adequate oxygen delivery. Optimizing erythrocyte function during CPB is important for ensuring that tissues receive enough oxygen.